Okay, we're back with Dr. Tasneem Bhatia, Dr. Taz. We were talking about connective tissue disorders, and I believe everybody listening to this program has some connective tissue disorder, and we tend to ignore it until it is too late. So why do you think we're having all this inflammation, if you will, connective tissue disorders, cancers? What do you think is going on in the environment?
So, that's a loaded question.
It is. I mean, we could talk for hours.
We could probably have a couple of conversations about this. But, when we think about inflammation and why it's on the rise, the first place you have to look is at our environment. And so we're exposed to things that 50 years ago, 100 years ago, our forefathers were not exposed to. And what happens with that chemical toxicity, environmental toxicity, is that you damage the immune system, you stress the body to a certain extent, and inflammation is ultimately rooted in changes in insulin, changes in stress levels, those type of things. So that's the number one thing. The second thing that's happened is our food supply is completely different than what it looked like about 50 years ago. Every basic food that we eat, whether it's water, gluten, dairy, soy, corn, whatever you want to talk about, is completely different than what our parents or our grandparents had. And I really firmly believe it's playing some role in wearing down digestive systems, which in turn trigger inflammation. So I would say stress, food, environment, those would be my quick answers to your question.
Well, and I think we are what we eat. We've said that forever, but it is more and more true. As an ENT specialist, I deal with a lot of reflux. Mm-hmm. Tons of it. Esophageal cancer has risen over 700% the past 3 decades.
Wow.
The fastest rising cancer we know of. In fact, and the second fastest rising cancer is also in my specialty, and it's head and neck cancer, oral pharyngeal cancer. That is more of induced by a virus, HPV. People are concerned about that. And I think we have got to stop this madness, this train of processed foods. That is the problem. Since we started having to acidify foods from the FDA back in, I guess, the early 70s, we've been eating processed foods. All these things create inflammation. Things that we think don't create inflammation. What's your thought? What's the number one inflammatory thing that we eat that people just don't think about?
Sugar. Number one thing, America has the highest consumption of sugar compared to any other country in the world. We import the most, we use the most, we eat the most.
And are we talking about sugar that we traditionally get out of the bowl?
Any form, high fructose corn syrup,
let's talk about that.
Sugar,
so it's corn,
honey, all
corn
of it.
syrup
Exactly.
That's changed into sugar, fructose. So most people know about that. And so what are we going to do? What's your suggestion?
Well, I think the number, first of all, it's just education. So many people I meet don't understand how much sugar they're getting in on a regular basis. I mean, the classic example is your yogurts. I'm eating yogurt. I'm doing something that's really healthy for me.
Right.
But have you read that label?
Yes.
Have you looked at the sugar grams
It's the biggest
in your
lie
yogurt?
told.
Exactly. So, I think education is the first thing. Look at sugar grams on anything that you're buying that's packaged or boxed. You really should not be having more than a total of about 40 grams of sugar a day, which is only about 6 or 7 teaspoons. That's the amount of sugar in about a half a can of Coke. And what's happening instead is that, you might have a sweet drink, especially our children, sweet drinks, sweet snacks, you have the flavored sugar. So things that are quote unquote healthy are really loaded with sugar. And that's the number one cause of inflammation.
Well, and then you can take this to an extreme. I'm going to, again, throw myself on the sword.
Mm-hmm.
I avoid carbs. I like to do that. So I'm kind of the opposite of that. I avoid fructose. I avoid I'm just cringing hearing you talk about the sugars. My carbs are fresh vegetables, which are good. So let's look at the other end of the spectrum. Let's talk about somebody like me who has some inflammatory issues that I avoid sugars. What are you thinking about for me?
You're already, it sounds like, on what we call the anti-inflammatory diet. I know you've heard about that.
Yes,
You're doing
I have.
a lot of fruits and vegetables.
Didn't want to steal your thunder. That was going to say it. But that's
I'm
what
super
I'm
proud of you. You get a super high grade in our practice. But anti-inflammatory diet is a lot of fruits and vegetables, minimal grain, minimal dairy, a lot of healthy fats. That sounds like what you're doing.
Right.
If you're still having inflammation after following that type of diet, then we dig deeper. Is there something going on with your stress level, with your hormones, with your micronutrients? A lot of times you'll be deficient in key nutrients that then in turn trigger inflammation. The most common ones are the omega-3 fats, vitamin D, vitamin B, magnesium. These are all things that we see that can play a role in inflammation. So for someone like you that's still having inflammation, but you're doing the anti-inflammatory anti-inflammatory diet, you probably need a nutritional, chemical, and hormonal workup to see where else it may be coming from.
Again, you're listening to Dr. Taz, nationally renowned author and holistic physician, is a medical doctor and director of holistic medicine at the Atlanta Center for Holistic and Integrative Medicine. Okay, what do you think our listeners need to know most about holistic medicine? Because it's non-traditional, and we don't know where to start.
So I think that's a great question. However, I don't even like the term holistic anymore. We're really using the term integrative because we want people to know we're not rejecting conventional medicine. What we're doing instead is merging, combining, expanding your options so you have multiple things to choose from, not just pharmaceuticals, not just surgery, but maybe we have something in the world of Chinese medicine or Ayurvedic medicine or nutritional medicine that might make you better and might get rid of your disease or your symptoms. So it's a merging. It's not a rejection. And I think that's the biggest confusion.
And in women's health issues, there's a lot more of that, I think, than men's health issues. So tell me, what advice do you have for women as they age? You know, what things can they do and what should they be thinking about in integrative medicine?
So women, I think women always forget to have a hormone evaluation every 2 years. You really want to know where you are shifting, where you're changing, and you don't want to get to the point where you're so sick and having so many different hormonal symptoms that it's impacting your work, your weight, your relationships, your life, how you function through the world. So one of the number one concepts I think I would take away from integrative medicine and from our practice is get your hormones checked. Every 2 years at least. Do a full battery, thyroid, progesterone, adrenals, all of that stuff.
And would that apply to men as well?
That would apply to men, but not in the complexity that women, unfortunately, we're hormonal creatures more so than you guys are.
I cannot comment on that because I am a man. And
I can comment on it. We're complex. We're hormonal.
Even though
everything
I am a medical doctor.
No, women are cool, man. Women are cool. Whatever they say.
That's who we are, and we need to embrace it.
Alfie, you're just kissing up to your soon-to-be wife.
I'm just saying.
I know.
It's y'all's world. It's y'all's world. I'm just living in it.
That's it, baby. Oh, I love it. So I loved your segment on Dr. Oz. Tell me, that's innovative. Integrative medicine. She had you had a patient on the table.
Biopuncture. That's
biopuncture.
Okay.
Tell me about that. And how's that different from acupuncture and traditional therapies?
Biopuncture is innovative. It's new, I think, to the U.S. Not too many people are doing it. They've been doing it in Europe for a while. But what we're doing is we're taking homeopathic medications or preparations.
Right.
Trameal, you might have bought that in the grocery store to help maybe that inflammation in your SI joint. Okay, hint, hint. But
yes,
you can take
I'm
that
listening.
And you can inject it into a trigger point, and that will often help with pain, with muscle inflammation, instead of having to inject saline or steroids, which a lot of people resort to. So, and we're seeing some great results with it. So we're very excited about it, and it's lasting longer than the typical
what is it
steroid
that you're using?
So it's homeopathic stuff. So it's either echinacea, arnica.
I love arnica.
So they're different homeopathic medications that are combined into a solution and then injected. So that's kind of the thought behind it.
Well, I may be more integrative than I thought. We provide allergy therapy, and we use arnica Montana for bruising in our plastic surgery patients.
Wonderful.
So if you're having Botox or you're getting a filler, that probably causes inflammation. We still are using
chemical toxicity.
Yeah, things like that. And kind of embarrassing here, but that's great. So I also want to talk about your book, What Doctors Eat. Give us a highlight.
So that was just a really fun book, and what it is, it's really, people are always like, oh, I'm not going to listen to my doctor about nutrition. They're drinking a Coke in the room, and, I saw them
smoking a cigarette.
Smoking, exactly. I saw them smoking out by the dumpster, So why would I listen to my doctor? But the reality is there are leading doctors across the country, I'll include yourself in that have really researched nutrition, thought about nutrition, and have made some positive changes in their life. So this book was like, hey, we're not all unhealthy. We do know a thing or two about nutrition and how to take care of yourself and how to eat. So let's put everybody together and see what they do. So you've got some good names in there. Dr. Weil is in that book, who's sort of the founder, I think, of integrative medicine in this country, talking about what he does, what his favorite recipes are. So it's a really neat book to look at how doctors take care of themselves, but at the same time, providing the reader with a lot of different recipes that they could incorporate into their own lives to create that anti-inflammatory Mediterranean diet that seems to work for the majority of people.
And you say Mediterranean diet. diet, and I'm a big believer in that. And listen, let me tell you, I'm a pretty simple guy. I'm very traditional about it, but as I'm aging, I want to do things that help me. As we're in the thick of summer, we're vacationing now too, and people want to know what tips do you have for us staying healthy while we're traveling? We're on the road, enjoying the summer.
So, the number one trap for everybody this summer, at least from what all my patients say, is wine and alcohol and beer. Everyone tells me that they're indulging more and more now that it's summer. So,
on Saturday morning, thank you, Vicki.
Unfortunately, and I always get asked this question, like, which wine is best or which vodka is best? But, ultimately, how does the body see that? It sees it as sugar, which then triggers inflammation. So my number one tip is if you're on vacation, have a drink or two, indulge, but in moderation.
All right, Doc, I'll do that. I'll take 2 Bud Light and I'll call in the morning.
I know, it's the most unpopular advice I think I give, unfortunately. So just watch that while you're traveling and on the road.
That's great.
The second thing is to watch when you're out eating out a lot. You're going to restaurants,
That's right.
You're going to different places. Watch the sodium content in your meals and pay attention to it. Restaurant food is loaded with sodium. So many people come back from vacation swollen. Like my husband will always complain he can't get his wedding ring on. Well, maybe there's a reason for that. But anyways, he'll complain that he can't get his wedding ring on. But so those are things to watch out for. So watch the sodium, watch alcohol, and then really watch your consumption of those cheap foods or those fun foods. We all tend to overdo it on vacation. So maybe just have like one day out of the vacation week that you'll do those, or one meal that you'll do those, but not every single meal.
That fits for me and works for me. Well, hope you'll come back to the show. That's all the time we have.
Thank
Dr.
you for
Taz,
having
thanks for
me.
being here.